The surprising symptom that we're looking at today is low libido. Low libido. You guys surprised to hear that? Some yeses, some no's, a lot of head nodding. A lot of shock. Shock and awe question. Well, low libido is a symptom. Why is that, Andrea?
Well, for a couple of different reasons. So we know that with diabetes, you have this really, really high blood sugar. But for many people, they experience fluctuations. And that can affect our mood, including our mood to be sexual. Well, the other main thing with type 2 diabetes is all that high blood sugar, it starts to clog up our arteries. And if you impede blood flow, particularly to those vital organs like the sex organs, it diminishes our sexual response and our ability to have orgasm. And in my practice, and my patients will tell you, I recommend that my patients have at least 3 orgasms a week. And so that means...
My kind of doctor.
Amen. No, but it's so important because sexual health is important for our physical health, our mental health, and our relationships. And so if you're not feeling in the mood, women over 40 should not dismiss a low libido and just chalk it up to being busy or, overwhelmed with the kids. It really can be a symptom of things going on inside of you.
With me is Dr. Andrea Pennington, an integrative medicine specialist and an expert on missed diagnoses. So, Dr. Pennington, you have busy practice. Give me an idea of what your patients are telling you about symptoms and why are they not coming to us with these problems?
I think women, particularly women over 40, don't come to us soon enough because they're so consumed with their lives, with their kids, with their jobs, with their families, and running households. And so I think that women downplay symptoms, things like headaches, things like abdominal cramping, and they just think that, well, even though there's all that information out there about diseases, it couldn't happen to me. And then unfortunately they come in and they find out that they're dealing with conditions that were totally preventable.
Andrea, walk us through what women should do if they are suspecting that they're having a stroke because of some of the symptoms that Judy was just mentioning.
Well, first things first, you've got to get to your doctor. Now, of course, if you're in the midst of a full-blown stroke, not these little, what we call mini strokes, if you're noticing that you've got numbness or paralysis on one side of your body, call 911. Do not delay. Because treatment, if you get it within the first 3 hours, can save your life.
Yes, sir. Andrea, again, walk us through why is it that bloating is so important for folks to think of as a sign of colon cancer?
I think, again, we women, because we have menstrual issues and we've dealt with them all of our adult lives, we sometimes downplay bloating. Or sometimes we recognize that our diet may lead to bloating and cramping. But one of the things you need to do is if you have changed your diet and you're cleaning up your diet, but you're still noticing this pain or this cramping or bloating, go see your GYN. Typically, we want to rule out that it's an ovarian cause. And then if you're still having these symptoms, you need to see a gastroenterologist or a GI specialist.
Dr. Pennington, thank you very much for joining us.
Thank you.
Cynthia, Judy, Mary, thank you for all your help, for your stories, and I hope this is informative for all of you. We'll be right back.